For decades, the CDC recommends a routine childhood vaccine schedule covering 17 vaccines. That schedule was built to protect not just individual children, but communities, schools, hospitals, and infants too young to be vaccinated. That number has now been reduced to 11. Several vaccines that were once recommended for all children, including hepatitis A, hepatitis B, rotavirus, meningitis, and seasonal flu, have been reclassified. Instead of routine use, they are now recommended only for children considered high risk or through something called shared decision making between parents and providers. Why does this matter to regular people? Because routine recommendations are what normalize protection. They drive insurance coverage, school requirements, pediatric practice standards, and public confidence. When vaccines are moved out of routine status, uptake drops. That is not theoretical. We have decades of data showing it. This change did not come through the traditional public process. There was no formal public comment period. The CDC's advisory committee was bypassed. Vaccine manufacturers were not consulted. The policy was implemented following a presidential memo and an internal review authored by officials who have publicly questioned vaccine safety. Health Secretary Robert F. Kennedy Jr. says this rebuilds trust. But historically, public health trust is built through transparency, consensus, and consistency, not abrupt reversals without public debate. We have seen this before. In the late 20th century, lapses in routine vaccine led to measles outbreaks after a similar confidence drop. The result was preventable illness and preventable deaths. Nothing was technically removed from the schedule, but shifting vaccines out of routine use changes behavior, especially in already under-resourced communities. The burden moves from public health systems to individual parents navigating risk on their own. This is not a neutral update. It is a policy choice with predictable consequences. If you want the fuller story and the context they would rather you ignore, join me on Substack. That's where I go deeper and lay out the analysis without restraint. The link is in my bio.